There's a lot of young adults and teens that still depend on a lot of their parents in many ways, which is typical. But I think that a lot of those learned behaviors, even from parents, have to be kind of pulled back a little bit.
But as they're building their communication skills independently with their clinician, that boosts their confidence and independence.
Welcome back to another episode of the Unspoken Words Podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode, we welcome back Dr. Jenna Blum, a lead clinical psychologist at the Smart Center and the director of the Smart Center's growing general mental health department, counseling and assessments. In the episode, Dr. E and Dr. Jenna emphasize the critical role of parents in supporting your selectively mute teen, the importance of setting personal goals, the foundational elements of comfort, connection, confidence, communication, and much, much more. Before we get started, if you have any questions on anything you hear in today's episode, please head to selectivemutismcenter.org/ask Dr. E. Enter your question in the form. The team reads all of your submissions, does their best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, for the best of this episode and every episode of Unspoken Words, make sure you're following the podcast on Instagram and YouTube. We are at UnspokenWords_podcast on Instagram and Unspoken Words Podcast by Dr. E over on YouTube. All right, without further ado, please enjoy this conversation between Dr. E and Dr. Jenna.
Hi, everyone. It's Dr. E. Before we get started with today's episode, I'm so excited to announce that our popular Selective Mutism in the School virtual conference is now available as a self-paced online course. The conference dives into how to assess the mute child, testing for common comorbidities, and proven strategies and interventions to support students with SM within the school. And of course, we dive into accommodations and interventions such as 504s and IEPs. The course offers 5.5 continuing education credits for most professionals, so parents, share this opportunity with your child's school. To sign up, just head to our website or check the description in this podcast episode. Together, we can create a world where every child has a voice. Now, enjoy the episode. Hello, listeners. It's me, Dr. E. Excited for our podcast today, Empowering Teens and Young Adults. It's a guide to boosting independence and confidence. I am thrilled and honored to be joined by Dr. Jenna Blum, who is our lead clinical psychologist at the Smart Center. Dr. Jenna brings about a wealth of information and experience working with teens and adults and children, of course. And we're going to walk through various strategies that are very practical and will definitely make a difference in the lives of our teens and adults and the parents or caregivers that are supporting our teens and adults, because I think they are such a critical component of this. Hello, Dr. Jenna.
Hello. How you doing?
I'm doing great today. And we already did our talk for younger children, elementary, preschool, and elementary age, building independence and self-confidence. And there's so much to talk about. We broke it down into teens and adults being a different episode. But as we know, this may end up with a couple episodes, knowing the way we are.
Yeah, I agree. We could talk for hours.
I think the way I'd like to start this, because you and I are very impromptu and we kind of talk from our heart and also what comes up in our thought processes as we are sharing our knowledge and, years and years of working with teens and adults. We know that many of the individuals that come to the Smart Center have parents or caregivers involved in their care. So I think I'd like to talk about the fact that for many of our, let's say, teens and young adults who come to us, how do we help the adults in their lives, their parents often with teenagers, be able to help implement all of the strategies that we're recommending? And I think that's going to be important. So I think as we talk about this, Dr. Jenna, I think we should also bring in how others in their lives can help support. And I'd like to start with how many of the individuals with selective mutism have that passenger in the car way of living versus being a driver in their own car. And I'm not talking literally, right? Do you want to touch on that? Because this is such a big part of what we talk about when we work and treat families with teens and adults and how we navigate this.
Yeah, no, I mean, you bring up a lot of good points. And I do think that many times when we have teens come and young adults, it's the parents that we have to talk a lot to, because I think that a lot of times, especially with the population that we work with, there's a lot of dependency. There's a lot of young adults and teens that still depend on a lot of their parents in many ways, which is typical. But I think that a lot of those learned behaviors, even from parents, have to be kind of pulled back a little bit. So I think the idea of the passenger in the car, and Dr. E, you mentioned this a lot at our communicamps, which is great, is the idea that many times if you envision yourself in the passenger of the car, so pretend that you're kind of the passenger in the car, and whether it's your spouse, your partner, your sibling, your parent, someone's driving you, you're kind of just driving. Maybe you're going to dinner that night. And let's say you're just like looking at your phone, you're not really paying attention to the road, right? And you get there, and then pretend that we were to say, okay, now I want you to drive back. Now we're going to switch spots. And now you're going to now sit in the driver's seat. The person that was sitting in the driver's seat is going to sit in the passenger seat. Most people would almost have this like fight or flight response of like, wait a minute, what? Like I have to now navigate everything on my own. I wasn't even paying attention. So I think the idea of the passenger in the car is this notion that many of our teenagers and young adults only really are the passenger in the car. They're not really paying attention to the nitty gritties of social interaction and engagement and communication. So when we then place that expectation and we say, okay, well, now you sit in the driver's seat, I want you to now give your order, they might not even know those skills yet, because their whole life, and for let's say a 16-year-old, for 16 years, they were never doing that. So I think parents have to understand that idea, that's a great concept, but it takes a lot of us then stepping back for then your child or your young adult to then become that driver. And we might need to teach them how to drive before they could just become the driver. So that's how I usually explain it, because I think many times it's easy to just throw yourself into the seat. But I think that really thinking about what that looks like is going to take a lot of steps to get there.
You explained it honestly perfectly. And that's exactly right. And I think the parents of many of our teens and young adults that are here, they're probably saying to themselves, wow, you're right. Like I tend to navigate. I often tell my child what to say and how to say it, like say hello, tell them what you want to eat. And so they're basically driving, even when they're almost like the backstreet driver of the car, even when the teen is in the driver's seat. And so what we're trying to do in order to build social communication confidence, but just even confidence and independence, is to be able to shift roles, but in a very gradual, respectful way, because that philosophy of now you can do it, you need to do it, you have to do it, you should do it. Of course, I would like to say I'm exaggerating that, but I'm not. There are many parents when we sit in session that are very much about, come on, honey, you need to do it. In order to get into that honors class or to be able to drive a car yourself, in order to be able to go to college, in order to be able to have that job or to make your needs, you've got to do it. You got to do it. But without that navigation system that they learn themselves, it just doesn't work. And you end up creating often more anxiety, more avoidance in our kids. And when we meet them where they're at, wherever that is, they then start to feel safe and are willing to take some steps. So in order to become a confident social communicator, someone that's not only verbal, but can be initiative, more elaborative, more confident, and presents that and projects that energy out, they need to be independent, way more independent than most of our clients and patients are. And so much of our work is, yes, building social communication skills and becoming a verbal communicator. But what about their confidence level? What about their sense of independence? And so that's what today is about, is how do we help them become a more independent individual where parents can kind of take some steps back and they can build that, because through independence is going to become confidence, and through confidence is going to fuel social communication progression, because they're going to be more willing to take a risk when they're confident, when they feel more independent. And that's how it all works together. Any comments?
Yeah. Well, I just want to emphasize, I know this is kind of going off script, but that's who we are.
That's who we are. That's what people love about us.
That is true. I think one thing that's really important for teens specifically and young adults is the idea of those three C's, Dr. E, that you talk a lot about. So, yes, I want to talk about those three C's that lead to communication because I feel like, especially with our teens, that's so important. So, there's the comfort piece, which we always talk about, and that goes for all ages, but specifically for our teens and young adults, they need that comfort for them to fuel that communication. They also need the confidence, like you're talking about. So if a teen doesn't feel confident, if they're so reliant on their parent, there's no way that they're going to start fueling that communication, right? And then the last one is connection. And I think we're going to talk about this more as we continue to talk. But I think that a lot of our teens don't have those connections. They're not in that driver's seat in honestly all of their social interactions and engagements. And so many times, when you're younger, it's easy to just say, okay, I'm going to set up a play date for you and your three buddies. But as we get older, many of our teens and young adults don't have connections anymore. And it's always like, well, where do I go? How do I build that? So those three C's, I feel like, are so important to progressing to communication in so many more ways.
No, that makes complete sense. And I think that's going to play a role. And as we talk about various strategies, interventions, and tools that these teens and young adults can utilize, very practical in their everyday life to help build that independence that will fuel all that we just talked about. So let's talk about goal setting. I mean, parents tend to have goals for their teens or young adults, and they give them goals often, right? This is what you want to do. This is what, I was working with a teen recently where the parent is very much like, I need her to get into this school. It's a really important thing to get into this honors school. Meanwhile, this teen is not connected. She's not comfortable. She doesn't communicate with anyone. She's completely aloof, completely anxious. But the goal is to get into this other school that's a high-powered academic institution because the mom, that's really important to her and she thinks would be important. I'm like, hey, I get that, but let's kind of build up where your child is now to be able to have that fuel to succeed in that environment. If we were to emphasize that environment now, that poor kid would be so shut down and anxious and become depressed. And that's why the goals that a parent has sometimes have to be adjusted to be able to build these other aspects up with their child so that the child has the readiness for so many of the big goals that maybe a parent has. But what are the teens' goals? What are the young adults' goals? What are their goals? So setting personal goals is such an important part of our treatment. When we're working through the selective mutism eval, when working for individual care, one of the first things we ask are, what are your goals? Now, many don't know, and they're like, I don't know, I don't care, I don't have goals, but they do deep down. And sometimes you have to help them. But tell me some ways that you work with your clients on setting personal goals.
Yeah, so I feel like actually before I even talk about goals, usually the first thing I always do with a teen is I always assess their level of motivation. So I usually will always ask them from like 0 to 10, 10 being the most motivated. I do want to work through this. I recognize it's feeling really, really, really hard and difficult, but I do want to navigate. I need someone to help me. 0 being like, get out of this room, right? I usually try to get a baseline because I find that if someone says they feel like an 8 out of 10 motivated, which we don't have the statistics, but I always joke that I would love to get it because I would say like 99% of the time, people always say a 7 or an 8. That's a very common level of motivation. And I feel like before goal setting, it's so important to assess motivation because usually when someone then goes into goal setting, and let's say they are a motivated teen, that usually will help me navigate. And let's say someone's like, I don't have any goals. I'll be like, okay, well, I know we really want to work towards this. I know you had just shared with me, you feel like an 8 out of 10 motivated. I know this is something that you really want to work through. Why don't I provide you with a list of some common goals that other teens and young adults have? And let's see if you want to circle a few that you also align with. So many times, again, that's kind of the social identity piece where they're now hearing about what other people similar to them might be experiencing. And that's that piece that's really important because that's the community piece, the piece that people feel like they're very alone. They don't feel like anyone really relates to them. So the minute that you start providing them with certain goals that could help them, you're not telling them what their goal is, but you're saying, hey, these are some common ones. Why don't you circle a few? Now you're passing them that autonomy and you're passing them that opportunity for them to be like, oh yeah, I do want to actually get more comfortable with my teachers. Oh, I do want to be able to progress across the social communication bridge with my grandma. I do want to form more friendships, whatever it might be. So I think before we really break down the goals, it's just really figuring out what even are your goals and how do we navigate that. So that's probably what I find to be the most useful is us having to help them navigate it. Because again, remember, they're not always the driver in the car. So they're always hearing their parents saying, this is your goal, this is your goal, this is your goal. But what really is their underneath goal? What does that look like for them?
Right. And when you do have a teen, and you mentioned quite a few will say 7 to 8, how many of our teens, to me, a lot, will not seem motivated. And when they're not motivated, especially in relation to social communication, it's often a result of years for the teen and adult of not being successful and feeling defeated.
Mm.
And often that's a result of too high of expectation over time and not having a clear path for their social communication with knowing what strategies to do, when to do it, have clear, concrete, written out goals. When I talk to most families that have been in past treatment, what tends to be missing is the actionable plan, the actual step by step, not just working towards it, giving them kind of a goal, but written out concrete step by step goals. That's almost like their own navigation system. Because I often say, when you get out of the Philadelphia airport and you're coming to Communicamp or you're coming to our center, do you just get in your car and drive aimlessly? No, you go to Apple Maps or Google Maps and you plug in our address and you go 3 miles north and then 2 miles, west and yada, 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 because you need that navigation and that's the goal. And I find when we start to work with teens, they become more motivated when we meet them where they're at. And sometimes meeting them where they're at is really a bridge down for many of them. It's not just being verbal. It's like taking that out of the picture. Of course, that's our goal, but we have to meet them where they're at and helping them. And I love what you said about kind of giving them examples of what some goals are. And that's the beauty that I see when they are working with others with selective mutism, like at Communicamp, honestly, they're working in a group and they're hearing what other teens' goals are. And that often helps them realize, wow, that's hard for them too. I would like to be able to do that, because let's face it, what teen or adult doesn't want to connect unless they have like a neurodevelopmental difficulty? And that's important to mention here, is that we do have a percentage of teens and adults that have neurodivergence, such as autism spectrum disorder, and they truly don't necessarily want to connect with peers. Not so much the anxiety, but it's a puzzle they can't figure out. And we're not going to get too much into it, but I do think it's important to differentiate that. So when it comes to setting goals, I usually say the big goals, the big long-term, big picture goals, and then what are short-term goals that we can start to do to get to those big goals? How are you doing that in terms of kind of planning and navigating their path to do that?
Yeah. So let's say one of the goals that a teen has is that they want to build more friendships. Because again, that connection, that 1C is so important. Usually what we'll do is I usually will break down into, okay, well, that's a huge goal that we want to work on, right? But what could that look like? And for many teens, again, the connection isn't always something that they have. And a lot of times that could be them not feeling as comfortable initiating into that type of environment. So let's say, again, the long-term goal, I want to build more connections, but then maybe in treatment, we start really exploring what that looks like. I learned that the child loves chess. I learned that they have a chess club at their school and we're talking about that. So maybe the first goal is, okay, well, let's look at our weekly calendar. Okay, if we want to build connections, let's kind of write down what are all the different social opportunities that we can have that can allow you to build those connections. And again, let's say it starts at chess club. So maybe the first step is maybe that Monday, we're going to write an email and we're going to send that to the leader of the chess club. And again, they're not used to being the driver in the car. So sometimes that could look like me helping them navigate that in session. And they send that out, right? Maybe Tuesday is the first time that they meet the chess club, let's say Wednesday's the time where they meet for the chess club. that means that Tuesday we don't have anything going on. Well, what could be a helpful way for us to prepare for the chess club so that we can feel more comfortable? Because we know going into situations when we maybe don't know anyone, that can feel really scary. And if we want to build connections, we want to think about maybe common questions that people might ask at that chess club so that we can go in feeling more prepared. And again, this could look different depending on where someone is on the social communication bridge, but whether they're verbal, using a transitional strategy, like let's say they have a verbal intermediary because maybe they have one buddy, or maybe their teacher is someone that can help navigate, or even if they're nonverbal, they can still write down, let's say, a list of some common questions. So let's say, that we come up with a bunch of questions, like what's your name? What grade are you in? If it's just a club, maybe the whole high school does it. Have you played chess before?
So you're basically mentioning with the common questions, greetings, but also doing action plans. Who's going to be there? What can they ask? What would be the answer? What could you ask? And you kind of walk them through. So we take each of these scenarios. And what I love about what you're saying is, in order to accomplish these goals, we're giving them a navigation. We're helping them step by step get there. Not, okay, I want to have more friends or connect more. We're having them play chess, something they enjoy with others. And through the activity, they will form connections, which will increase their confidence, which will increase their communication, most likely, especially as we prepare for it. Hey, listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode. So I love what you're saying. So we're going to write those lists. I love the concrete nature, Dr. Jenna, of writing out what those goals are. So we're talking about them, but we have either a journal or a notepad on our iPhone or our iPad, or just like I said, a little journal. They go out and they do kind of a store exposure to get a journal, to be active participants in their goal setting and personal goals. So they're writing it down, and then we're navigating each one. And that is something we absolutely work on with these kids in therapy, because it's about them knowing how to accomplish that goal, not just this is your goal. And that leads me to the time management aspect, planning goals, how to do them. So by doing the personal goals, independence, it's creating independence. By managing their time, independence. It's helping them become a more independent individual without relying on mom, dad, or whomever to tell them you need to, you should. But what is their schedule? Their daily schedule, their weekly schedule, their monthly schedule. How do you manage time management with your teens and young adults?
Yeah. So, I mean, like I was saying before, many times I'll make like a weekly calendar with my client, and I will say to them, let's say, you have a dentist appointment on Friday, you have chess club on Wednesday, you have our session on Monday. Let's try to find those pockets of times where your other goals come in. Like, let's say one of the goals is just going out and about, practicing, in the store or in a restaurant, doing exposures. Oh, I see on Tuesday, we don't have anything in that afternoon. Why don't we plug something in there? What does that look like for you? So I'm giving them, again, that autonomy, that independence to say, what do you think you would want to work on in that time when you're going to a restaurant? What questions might you want to ask a waiter? Again, depending on where they are on the social communication bridge. But I think that having that weekly calendar a lot of times, one, gives them that accountability, but it also gives them that visual cue as a reminder of what they want to work on. And for many individuals that aren't used to being the driver, they're the passenger, they a lot of times need those steps to help navigate. So weekly planners are amazing. We're obviously in the digital world, so many of my individuals will also use almost like digital reminders. There's great apps that kind of have those reminders. And for many of my teens, that's a great way for them to feel again, autonomous, like they can do it on their own, but maybe they need, more of that assistance. Again, let's say a child has some more executive functioning challenges. That is a common why that we sometimes see. We're just helping them navigate that time management. And that's a very typical challenge, honestly, for even any neurotypical child, I feel like, who's navigating for the first time. So I think that having some of those skills set in place is a perfect way to start. That's usually what I do when I'm starting the process of goal work with them. And I think it allows them to see what they want to work on. And again, we're working on these small goals that are leading to this larger goal, which feels more attainable for them. So that's the confidence that starts coming in.
You mentioned something about executive function skills. We talk a lot about the term SM, and I am going on a little tangent, but again, it's who I am, but I'm trying to help people conceptualize this, that SM being a social communication anxiety and understanding why they even have it and what may be maintaining it. It isn't just what goals do we have to become verbal. And I think that I would love our listeners to understand that. I know that's your big picture. I know that's what our goal is. But there's things in the way that may be preventing that. And those are the whys. And we have more than people realize a percentage of individuals that have other reasons like learning, processing, like difficulties. We were just talking about this earlier with our doctoral trainees about testing. We do so much testing at the Smart Center to assess their learning, their processing that may be causing them more anxiety, may be causing them so much stress, not keeping up, needing prompting, redirecting, not starting or completing tasks on time. Parents are frustrated. They're not following directions. They're doing this, that, and the other. It isn't even about talking. And so I think it's really important that if you have a teen or there's a young adult here that struggles in various areas that involve learning, processing, and I'd love you as a, clinical psychologist to kind of touch on that a little, because some of the ways that we're helping build independence, you're almost assuming once you give them this tool of let's build independence by time management, that they can perhaps do it all on their own. But we do have quite a few. One, either they weren't a driver in their car and they almost like no idea. They're like, I have no idea. It's like a new world. But there's also individuals that innately have this difficulty of not being able to manage their time or make decisions or whatever it might be. And so talk about that a little bit.
Yeah. I mean, I think that, again, this could be a whole other podcast because I feel like this is a really, really large topic. But many times, in a lot of the other podcasts that I know that you have shared, it's the idea around, is your teen or young adult experiencing these challenges even in their most comfortable setting? So if you find that even at home, let's say, your teen's doing math homework and you're still noticing in the most comfortable spot for them, they're still struggling with time management. They're still struggling with organizing, planning, putting those thoughts together. They're still struggling with forgetfulness or whatever whatever it might be. That might be an indicator that there could be something underlying there. Because again, we always use what is your child or teen doing in the home environment because that's where they're the most comfortable. So if you're still seeing a lot of these challenges, if teachers are seeing some of these challenges, right, that your individual is, maybe not starting or completing tasks on time, or they're struggling with even initiating that. And maybe there's not an underlying learning challenge because maybe they've done some cognitive tasks. Maybe there is that underlying executive functioning difficulty that's making it really difficult for them. So imagine, now we have, like Dr. E is saying, we have this whole added component where we're not really sure what's going on. Maybe they don't understand and they haven't identified with that. So imagine how that's impacting their confidence, how that's impacting their connection and their comfort. And then we're expecting them to communicate, right? So that's where those 3C pillars are so important, because I think many of our individuals that do have some underlying challenges, and especially as we get older, it might not be executive functioning. I'm not saying that, but for many of our teens and young adults, it gets more complex, right? In a variety of ways. So I think that we really do need to pay attention to what else is going on, because that could be impacting those 3Cs that are then impacting the communication piece.
No, I think that that's great. And that's where look, listen, and learn comes into play. What is your teen or the young adult in your life telling you by what they're not even telling you, by how they're appearing, do they avoid certain situations? Do they seem more anxious in certain situations that aren't even related? Are they struggling at all with understanding the social puzzle? Are they having difficulty with time management? Are they having difficulty? And are you the driver in the car because your children truly can't do it? Or have you just been doing it with them and they have the ability? And I think, at least for us, you know, I always look at the selective mutism eval. You know, when people come to the center, we do this evaluation to understand and conceptualize their particular case. And we screen for the whys. We understand that.
Mm-hmm.
We start to, you know, we know where they're at with their social communication bridge in every setting. And we're able to get a picture of who that individual is to begin the treatment process. Because you can't just treat to speak. You've got to understand. Right. And when that piece is missing of the understanding, it's going to affect your rate of progress. It's going to also affect that teen or adult's willingness to be involved in their treatment. And what we end up seeing as kids get older is they become more separated from their parents, sometimes resentful, sometimes more avoidant. And when that is occurring in your home and your child or your teen or adult is like, I don't want to deal with it. They're not telling you things. They're avoiding. They're spending more time in their room. You've got to have them fully evaluated because there's something missing that hasn't been addressed. And so I think it's really important that look, listen, and learn component to who they are by not even what they're telling us. And as far as independence goes, how can they become independent if we're missing something? And as you said, it affects all these other aspects that lead to a confident social verbal communicator. And so let's talk about decision making. One of the biggest areas that we see as a struggle is parents often make decisions for them. You need to, and you should. And you know, I say this all the time to parents is you've got to avoid that language of need to and should language. Stop it. Let's stop it as of today. Okay. No more you need to and you should, because what that's doing is that's creating like a barrier with you and your child. You're almost like going at them. You need to, you should. No, let's stop that. Let's meet them where they're at and help them, guide them rather than tell them what they need to do. And so one way we start is by having them make decisions. We ask them questions. So talk to me about that and how you implement that in your practice.
Yeah. I mean, again, I think if they're not used to being that driver, I think decision making can be a huge struggle for many of our teens and young adults because, like you're saying, they're not used to making those decisions. So, you know, many times I start maybe with some pros and cons lists, right? Of like, let's say, you know, they do want to join the chess club. I'm just going to stick with that example. And, you know, maybe the decision is whether they want to join the chess club in school or outside of school, right? And there's two opportunities, right? I might help them navigate, okay, well, what are the pros of joining that chess club in school? Okay, well, maybe a pro is that I can build more social connections in my other classes. I can, you know, start to form maybe some lunch bunch type of activities during lunchtime where maybe I could bring in chess and I can have a teacher who I'm really comfortable doing that. Maybe some cons are that I'm a little bit self-conscious and I'm not ready to, you know, go into some of these social interactions if maybe my peers are still seeing that I'm struggling with some social interaction. Maybe some cons are, you know, that I'm not as close to that teacher that is leading the chess club, right? And so what could be some pros about maybe joining a chess club outside of school? You know, oh, well, again, maybe it's like a great opportunity to do something I'm interested in. I do have one cousin my age that is able to join with me because they're not at my school. So that's another social connection that I feel closer with. Maybe some cons are that it happens on like Thursday afternoons, which is an opportunity that I can have at school because I also am on the tennis team. Maybe another con, you know, whatever it might be. I think that a lot of times decision-making can include, let's just break this down. Let's really talk about why we're making this decision, what this looks like for you. And let's talk about the feelings that you have around this decision. And that's where many times we'll talk about what we utilize, which is something called a feelings chart, right? Where many of our teens utilize a 5 to 0 scale, 5 being the most difficult, you know, the most anxiety provoking 0 being the most comfortable, where do we feel in the feelings chart after making that decision? Or what does that look like for you? So again, usually helping them navigate by giving some choices, giving them a pros cons list, maybe making a list of all the things that they would like to do, and then also navigating their feelings around that. Because again, many of our individuals, especially our teens and young adults, they're not always asked, well, what does this feel like for you, right? They might feel shame for it feeling difficult for them because they're like, why is this hard? It's not that difficult to just join a chess club. But for a lot of our teens and young adults, that social initiation piece is really tough. And they're not used to, again, building that independence where they're doing it on their own. So all of those are tools that a lot of times I will utilize with my teens and young adults.
And so what you shared was a lot around working directly with them and also like their own personal goals. But everyday parents, because a lot of these teens obviously live with their parents and even some of the young adults. And if adult is, let's say, married or has a partner, their partners can do this because sometimes they gravitate as they get older to those that will make decisions for them or tell them what to do because they've kind of taken that back seat their whole life. So parents very easily can help build that autonomy with their child or their obviously child teen, you know what I'm saying, is by just asking them choices. Would you rather you need to do your exposures. You know, we can go out now, or you can maybe do it in the evening after you do your work. Or, you know what, you wanted to get together with a friend, you know, do you want to text? Do you want to email? Simple things every day. Hey, we're going to be going away. You know, I know we need a packing list for our trip. Instead of doing it for them, have them make the decision of what they want to bring and make a list. And so that easy decision of, the aspect of decision making can come in where they write out. Some kids can't express themselves well for what their thoughts or their opinions are. So I'll often ask during a session for them to write down, what would you rather do? What are some, you see what I mean? And they'll take their time to write it down and then read it to me if they're verbal, because they can't just always just say it because they need to think about it, because this is a new skill. Look, when things get easier, you don't need to be planning it as much. But in the beginning, when they're learning these new skills of something as simple as decision making, and some of their siblings make decisions for them, they bond with peers that are more kind of outgoing, more of the extrovert that will, let's go over here, let's go do this. And so they tend to sometimes to be more of a follower, not because they want to be or they don't have leadership capability. In fact, that's an aspect of treatment, is that big shot role to help boost them up. Whole nother podcast. But I think it's important that we're very patient as we help them with decisions. And sometimes we have to break the decisions down more and more. Let's talk about just in general communication skills in terms of, look, we can go on. That's what we do every day, is talk about communication skills, but also like building for individuals who struggle with anxiety. It can be very motivating to work on skills in these areas to help them make that progress across the bridge. We often say that as individuals age, they're not always completely mute. Some are, but some are not. Sometimes they're quiet, they're not initiative, they're not elaborative, they're not expressive, they have difficulty with conversation starters, conversation expanders. And so they kind of stop there when they become verbal. And those are the areas that we work on with our verbal teens and adults. So again, they may struggle in specific areas, but as they're building their communication skills independently with their clinician, that boosts their confidence and independence.
Yeah. I mean, I think that communication skills in general is really important. I think that especially for our verbal individuals, being aware that communication, you know, is all aspects of the social communication bridge. And many times at Communicamp, especially when I'm having these conversations with parents, I'll mention that for those individuals that maybe are verbal, but need those added tips for expression work, elaboration, right? Thinking about expanding more initiation skills. We also have to think about the nonverbal communication skills. And I think that I always tell people stage 1 on our social communication bridge isn't a lesser stage on the bridge. It's just a different skill. And so for many individuals, communication can also look like a parent stepping back while the child is starting to pay for more things. The child is starting to, order their own meal, even if it's nonverbal, but they're just starting to navigate on that front line more. It could look like them going to the movies and them paying for their own ticket or grabbing the ticket. It could look like going into a store and putting the things on, the conveyor belt and then them grabbing the to-go bag from the cashier instead of the parent. It could look like going to a relative's house and handing over the fruit platter instead of mom or dad. So all of these are different examples of ways to add even more social interaction, engagement, and communication, even non-verbally, because many of our individuals, especially our teens and young adults, even non-verbally, they don't have those communication.
No, you're absolutely right. I'm
skills.
thinking of a teen I worked with just recently. They traveled in, we did a 2-day intensive, and the parents were all about needing to speak and wanting them to speak, and they had been in past treatment. Child's now very avoidant, very resistant. But when we really did a SCI, the social communication anxiety inventory, to determine where this, teen was functioning, he wasn't even able to give his credit card. He wasn't able to wave to somebody across the street. He wasn't able to shake someone's hand to show that confidence when he was meeting somebody. He wasn't able to hand in his homework. He wasn't able to write in response to his teacher's questions. So he wasn't doing any of that. And how can he, see what I mean? So I always say that the fuel for social communication to progress across that bridge is building up the areas of nonverbal social engagement, handing, taking. It stimulates eye contact. We demonstrate this all the time in sessions. We do it in the audience with camp, where I'll hand something to somebody and I'll say, did you notice what happened? By me handing you that pen, you made eye contact with me. That is the first step and fuel to social engagement and communication. Too many people are jumping right to speaking without building these necessary skills. The act of head up, eye contact, smile, just greet them. That is a projection of confidence that many of these teens and adults lack. They slump, they have their head down, they don't look confident. So the message you're giving others isn't one of empowerment. It's one of leave me alone. Don't talk to me. I don't want to engage with you. I don't want to be with you. So some of our work is that confidence building in their nonverbal projection of themselves in a positive way. And so by building these skills, you're increasing their independence because they see what they get back from others as head up, smiling, engaging as we work with them. I have to work on some to smile by just trying to get them to take this edge of their mouth up to their ears because some just can't even smile. They get that flat affect when they're anxious. So we have to, humor works great, but we have to work on these things. So building communication skills is critical as we're moving to build independence. Of course, that's in this whole process of social communication skills. As kids get older, teens and adults, financial literacy, something like, okay, it's not related to social communication, but to be able to have that ability to budget for themselves, to be able to manage their money. Too many times I work with parents with teens and adults that they're managing their finances. They're writing in their checkbook for their child. No, we need to get them to be more independent in their everyday life as they start to navigate towards going out and about, going to college, hopefully, getting a job, hopefully, moving out on their own, hopefully. And so we need to teach them all of this so they have that confidence. That's not like a big area we can focus on today, but do you know what I mean? Is that an area that you work on with the bank accounts, having their own checkbooks?
I mean, not as much. I think, again, this is such a nuanced and like a case by case situation. I think that's definitely really important. And I think that's something that I have navigated with some of my clients. But I think that all the other pieces that we're kind of talking about, come first in terms of like building up more of their confidence, comfort, connection. And then that's kind of like, again, that's where like our goal work is so individualized. So we're sharing a lot of this information, and as we do in many of our podcasts, but again, each child and teen and young adult, even into later adulthood, is so different. So that could be something that I think definitely could be really helpful for our young adults for sure.
Yeah, when I deal with that, it's often some of my young adults that I work with that can verbalize and they're trying to become more independent. And I'm amazed how many don't manage their own financial situation or understand the budgeting process. So as we're building independence, this is an area that we may focus on. Like you said, it's not everyone. I want to talk about self-care. I talk to a lot of parents and they'll tell me sometimes with their 13, 14-year-old, they need to remind them to shower, change their clothes, brush their hair, brush their teeth. Now, most are very conscious of those ages of looking good, smelling good, taking care of themselves. So when a child, or when a teen rather, or a young adult isn't paying very close attention to grooming, to take self-care, it makes me wonder what else could be going on developmentally to think about. So again, I don't want to spend the entire rest of this podcast talking about it, but I work with so many teen families and adults where one of the biggest complaints from parents is they just don't care. Well, you know what? They should care. And if they don't, there's something most likely developmentally going on that at that age when they've gone through puberty and they are going out and about, they should care. Now, is there depression going on? Is there neurodivergence, autism spectrum disorder? Is there anything else you want to add in?
Yeah, no, I mean, I think that's really important. And like you mentioned, of course there could be some, neurodivergence to think about in terms of like them having to navigate or them even having, some adaptive functioning difficulties. I think that, like you mentioned, the socio-emotional piece is really important. And as we get older, again, the whys get a lot more complex and there are a lot of comorbidities with socio-emotional challenges like depression, really high-end anxiety, various other factors. Some individuals, again, every individual is different, but I do think that if you're noticing a lot of these challenges, it is really important at that point to seek help and to make sure that, your individual is safe and that they aren't in a state where they're not feeling like they want to harm themselves or do anything. And so many times when I notice that sometimes someone isn't taking care of themselves, I think it's always really helpful to do a risk assessment and just make sure that they are at the point where, that they feel safe, that you feel safe. And again, that is where a professional can definitely help you navigate that.
And just to kind of tangent off a little with the self-care, I think that for a neurotypical individual that can independently manage, when you're dealing with time management and goal setting, I think it's important that we think about the amount of sleep, limiting devices, really working on exercise, movement, because that boosts the feel-good chemicals, looking and physically feeling good. All of that builds the independence. So fitting into their time management, their schedule, their weekly schedule, times to exercise, what is their sleep hygiene, kind of the grooming, the showering, all of that should come natural for most teens and adults. And we talked about when it doesn't and how to kind of think about that. But it's important while they're working on their kind of independence that they do fill in with working out, even if it starts out with a bike in the basement or going for a family walk, getting that physical activity, going to the gym, joining dance classes or yoga classes, anything they can do to build themselves up will fuel their independence, which again will go back to confidence and kind of they're feeling good to connect and build that connection with people.
Yeah, definitely.
All right. So now I don't know where we're at time wise, but I'll say, so this has been a lot of information, Dr. Jenna. Let's do part 2 coming up. I know we have a lot of podcast dates on the calendar because we've talked about a lot, and I'm pretty confident the adults in the lives of the teens and the young adults that present to us will really value a whole nother section rather than rushing through it. So this has been just, to me, really great to hear your perspective, to share what we experience. And my hope is that whether it's a teen or adult listening to this, or it's parents, caregivers, that they're gaining a lot of really good information to kind of really implement in their teen and young adults' life. And of course, we are always here to support them, help them. whether it's a state we're licensed in or doing parent coaching and training or teen coaching and training within states we're not necessarily licensed in. We certainly can help support. So thank you, Dr. Jenna. This has been wonderful.
Yeah, no, thank you so much. And I really enjoy this topic because I think there's a lot of teen and young adult families out there that, have navigated this challenge for a really long time. And they might be feeling like a lot of the skills and tools that we talk a lot about in our other podcasts really relate to maybe their child when they were younger. But as they're getting older, there's so many more complexities. So I do think that this is a very needed topic. I know it's a topic that we've been requested many times. And so we're excited to definitely extend to a part 2 where we could talk more. But thank you so much for having me. I love coming on the podcast.
Well, you're a permanent fixture at the Smart Center now.
That is true. Yes. So thank you so much. And we will have a part 2 out shortly, which I think will be very, very helpful.
Thank you, everyone. Have a great day. Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.